Hello. We thank you for choosing Salute Rehab Limited's Just Walk rehabilitation device, designed and manufactured by Chaban Medical Limited, Israel. This video, brought to you by Chaban Medical Limited, demonstrates how to set up, operate, and provide basic treatment to the patient. Just Walk is used for walking and upper limbs rehabilitation, as well as muscle strength training for both lower and upper limbs. It is suitable for both adults and children in hospitals, clinics, and for home care use. The Just Walk device provides the ultimate toolbox. The device is suitable for patients suffering from stroke, traumatic brain injuries, spinal cord injuries, multiple sclerosis, foot drop, Parkinson, cerebral palsy, orthopedic injuries, and muscle weakness in the elderly. By operating linear and stable resistance, Just Walk increases the approximation, thus helping the patient to be more aware of his limb's location, and is beneficial for motor learning and muscle strength improvement. In some patients, the results will be evident immediately upon using the device, as it will increase the approximation. Yet, in some patients, results will be felt only upon removing the device, since it may be harder for the patient to walk while the device is on. Both reactions are beneficial, as it will improve the patient's gait and balance over time. Before using the device, please follow the precautions below. The device must be used in accordance with the treatment provided by a certified therapist and according to the user manual. Not to be used on patients with regional disorders, such as fracture or dislocation, which could be adversely affected by the device. Not suitable for pregnant women. Not suitable for patients with pacemakers. Just Walk device setup. Adjust the device's belt, vest, and sandals for the patient using the adjustment strips. Make sure the sandal's soles are placed correctly, as the sole's connectors must be placed on the side of the shoe. Insert both resistance units, rollers, into the roller's base in the belt. Adjust the required roller resistance, base to 3, and connect the rollers to the sandals in accordance with the treatment given by your therapist. There are several ways to connect the rollers to the sandals, and the selected way depends on the patient's disorder. Adjust the treatment. In order to adjust the treatment, please remember that while some patients react better to assistance, some patients react better to resistance. The therapist should study the patient using a timed up and go test, four-square test, or another type of test in the first session and during the treatment period to verify the patient's progress and change the treatment if needed. To increase approximation, the therapist may choose to connect the roller on the forefoot, the most common connection for walking rehabilitation in neurological patients. To support the feet and aim the feet direction inward for patients which respond better to assist, the therapist may connect the roller to the sandal in the forefoot, yet transfer the roller's wire from the internal part of the leg. To improve gait length, the therapist may choose to connect the rollers to the back of the sandal. The resistance during the treatment will improve the gait length once the device is removed. Upon adjusting the treatment, the patient should walk with the Just Walk device twice a day, 15 to 20 minutes each session. During this treatment, it is recommended for the patient to walk with the device continuously for 10 to 15 minutes, and in the remaining 5 minutes, perform lateral walking and then go up and down the stairs. For this exercise, it is recommended for the patient to have one of the family members secure him, yet it is not a must, and depends on the patient's condition and therapist's recommendations. Additional way to use Just Walk is for muscle strength improvement and for upper limbs. Perform the exercise while sitting down for knee flexion and dorsiflexion, as well as upper body exercises. In order to perform exercises for upper limbs, connect the rollers to the upper limbs handles, available only on therapist set or by order, and perform the exercise for the chest and arms muscles. In addition, the therapist may connect the rollers to an external fixture stripe in order to perform exercises for lower and upper limbs on additional muscles. Thank you for your time. Should you have any questions, we're at your service.